My name is Dr. Armida Reitzel, but I very rarely use the term doctor. I usually go by the nickname of Doc. Or as some of my students last semester they started calling me Grandma Doc. I've been here in Humboldt County now since the fall of 1981. I've been a professor that entire time, so I just finished my 36th year of teaching. It was this past fall that I noticed there was something a little bit different going on with me. And one of the courses I teach, it's on top of a huge, very steep hill. And I found every day that I was going up there, I kind of felt like the Energizer Bunny running out of battery little by little, but I must have known intuitively that something was going on. So we jumped in the car, I drove myself to the hospital and walked in there, and they said immediately I was in the middle of a heart attack. I had no idea.
So I first met Mrs. Reitzel in the emergency room. She was having a lot of chest pain, and her simple test, an electrocardiogram, diagnosed her as having a massive heart attack. And probably from the time I first met her, it was less than 45 minutes that we were taking pictures of her blocked heart artery and opening it up with a stent.
It was like the opening scene of ER. All the doctors, the nurses, everybody there, lab technician, whoever is there, they're all standing there waiting for me.
She looks very healthy. She had no prior medical problems. Her blood cholesterol was normal. But heart disease is the leading cause of death in women, and early recognition that chest pain could be due to a serious heart artery problem is important for all of our patients.
When I wake up, I have to tell you, it was the first time in months I didn't feel the pain that I'd been feeling. That absence of pain told me, oh, they did something good here. I think one of the best things, number one, was Dr. Michaels. He's phenomenal in terms of his communication style. And being a professor of communication, I feel like I have some credibility to say that. His bedside manner was spectacular. I was so impressed because having gone through this unbelievable experience, my life totally changed in just a matter of a few short hours. That having him explain to me what was going on and what would go on, I really appreciated that. And the other thing that I really appreciated about St. Joe's, the cardiac rehab was phenomenal. I completed my cardiac rehab this summer, kind of a little party. The only thing I was disappointed about is the t-shirt that I got at the end was red and not tie-dye.
The way we take care of patients at St. Joseph Hospital is just like it was when I was at UCSF or University of Utah. So the hospital is very modern, a lot of resources. And I really enjoy following patients over time, seeing how they're doing over time, getting to know them.
I realized I really probably needed to get to the hospital on a Wednesday night, went in on a Thursday morning, and I was out of the hospital Saturday morning, back to work on Monday. It was phenomenal. That's my story of my heart attack. It's actually ironically, I think one of the best things that ever happened to me because it got me to reevaluate who I am, what I do, and what I can do for other people.
I've always wanted to be a physician. From a young age, my father was a physician. I've always liked science and trying to help people. And that's my commitment, is to help patients get through heart problems and really thrive.